Welcome back, everyone, to Life Uncensored, navigating adulthood one episode at a time. We've got a great show for you today, and I cannot wait for you to meet our next guest. Before we get started, I want to thank all of my Facebook followers. We are well over 11,000 followers on Facebook. So, shout out to my Facebook followers. Please continue to like, share, subscribe, and please find yourself over at our Instagram page at Life Uncensored Live. Like, share, follow there as well. And tell your friends, tell your family, tell everybody, right? Because we've got a little something for everybody on Life Uncensored. So, without further ado, I want to introduce our next guest. Her name is Jennifer Brooks, and she is riding shotgun today while we navigate adulthood. Jennifer Brooks is the founder of Unlimited Expressions, PLLC, a private practice specializing in evidence based speech and language therapy for children and adolescents. She holds an undergraduate degree in communicative sciences and disorders from Hampton University and a master's degree in speech language pathology from Howard University. And she is certified by the American Speech Language Hearing Association, also known as ASHA. With over 20 years of experience, Jennifer and her team are dedicated to providing personalized intervention strategies to empower students and families in the Washington, D.C. area. So, without further ado, please welcome Miss Jennifer Brooks.
Hi,
Hi,
Amanda.
hi. I'm so glad to have you. I'm excited to see you. I'm excited about this conversation. I feel like it's going to enlighten some parents out there, some caregivers, some educators, family and friends of parents um, and educators. And I just, listen, I just can't wait to get going here. So let's jump right into it. You are now part of the Life Uncensored family, so I'm going to treat you as such. All right, we're going to have us a good time tonight, even though we're talking about a pretty serious topic. Okay,
Sounds
so
good.
my first question to you is what I'm assume most people ask you:
hmm
How? Why? Like, what drew you to this vocation, this profession
hmm
initially, and what continues to fire that passion for you?
Well, I've always been interested in communication. I think it had a lot to do with being raised in the church. Um, as children, you're always tapped to greet the visitors, stand in front of the church and greet the visitors. Um, memorize that Bible verse for the Easter play or participate in the Martin Luther King oratory contest. So I left home and went to Hampton with the idea that I was going to get a degree in mass communications. Um,
Wow.
yeah, was very interested in having a career in television and or radio. But I ended up attending an undecided majors like seminar with a friend of mine, and the department chair of communicative sciences and disorders really sold me on the field and on the career. Um, what I liked about it is that it still dealt with communication, but it's much more
Mm-hmm.
personalized.
Mm.
Um, and speech pathologists can work in a variety of settings. Um, I've spent most of my career in the school setting. And so, being a child of educators, I've seen service in action. So, being a speech pathologist in the school based setting just kind of felt normal and natural for me. And it's a way for me to honor my parents' legacy.
I love that. That's amazing. So you kind of pivoted without realizing that you were going to pivot. So
Right.
then how was that received by your parents? Like, hey, I'm going to school for this, but I just went to this seminar and now I'm thinking about that. Like, how did that go?
I think it was well received
Yeah.
because the field of mass media is very competitive. So I could have had a degree in mass communications and not had a job
Mm.
or had to have obtained a job in a different field. So
Gotcha.
one thing that the department chair at Hampton shared was that the field was in high demand.
Mm.
So,
Wow.
you know, that sat well with my parents. And another thing that drew me personally to the field was that there weren't a lot of African Americans in the field.
Wow. Okay. And I hadn't thought of that, but you saying it, though surprising, it's actually not really surprising at the same time.
Right. Even now in 2025, the field is about 8% minority, and of
Mm.
that is about 3% Black.
Wow.
Yeah.
Okay, ladies and gentlemen, did you write those statistics down? Because that means something. So you're in a space where you are needed for very specific reasons. Like it's not just, oh, you're needed in the field because that field is underserved, but also in that minority side of it. Wow.
Yeah.
Okay. That's great. That's great. So talk to us about, I titled this episode um, Empowering Young Voices.
Mhm.
So, talk to me about that in your work. How do you define empowering young voices?
Well, the way that we empower young voices at Unlimited Expressions is really giving children and adolescents tools that they can apply through their communication development that allows them to express their ideas, feelings, and thoughts effectively and with confidence.
Mm. So, how do you feel? You have a parent come to you and say, I'm interested in your service.
Mhm.
And they ask you, what is that? How do you define that? What would you describe to them? Like, what does that look like in the tangible sense?
Well, it depends on a number of things. Really depends on the age of the child. I mean, there are certain developmental milestones
Okay.
that we will be looking for as clinicians. There's, certain speech sounds that a child should be acquiring by a certain age, as well as
Okay.
different language concepts
Okay.
and vocabulary
Okay.
by a certain age. So if the parents may express or share that the child may be saying certain sounds incorrectly, or they're not talking as much as they think that they should be, we can provide what we call a speech and language screen to decide if we need to do what we call a deeper dive, um, which would be, made up of, a formal assessment that will
Okay.
give us an idea as to how the child's functioning. It really gives an idea of the child's strengths and their areas of growth.
Okay. So,
Mhm.
have you ever come across, 20 years is a long time, right? Have you ever come across a situation where you find, and I'm just using this for example, hey, my child is not pronouncing words correctly and he's 4, he's 5, he's 3, whatever the age is,
Mhm.
that I feel like he should be, my other kid was no problem, that by this
Mhm.
time they were talking and moving and
Mhm.
shaking, and then you come to find out through your um what do we call it,
An assessment or
your
evaluation.
assessment, okay,
Mhm.
yeah, through your assessment, that, oh, your child is hard of hearing. So they're probably not hearing you express. Like, do you come across that often? Is that a common
Well,
thing?
um, a hearing evaluation or hearing screening and a speech and language evaluation should really go hand in hand. So, definitely a hearing impairment can certainly impact a child's speech and language development.
Got
Um,
you.
so it certainly is always recommended that uh, a hearing screening is conducted.
So would
Um,
that happen even before they see you for your
that would be
evaluation?
ideal, so that
Okay.
we have that information,
Okay.
so that we can make, strong clinical decisions, but
Okay,
it doesn't happen all the time. But it certainly should be indicated in a speech and language report that a
got you,
hearing screening be conducted.
got you.
Mhm.
Okay, so I feel like this next question kind of goes hand in hand with the empowerment piece of it. How
Mhm.
would you say that a child's self-esteem is strengthened through speech therapy?
Oh, in many ways, you know, individualized. Well, speech sessions are individualized, kind of meaning that they are shaped around a child's interests.
Okay.
Um, so when a therapist presents a student with kind of engaging activities, um, that allows them to, stay engaged and want to participate and learn new techniques and strategies. Um, that allows them to eventually reach their goals. And
Mm,
once a child reaches their goals, that allows them to, or when a child sees growth,
mhm,
that allows them to, build up their self esteem, because the child doesn't just see it, the parent sees it. The classroom teacher may notice it as well. So,
So
and
I was gonna
mhm,
say, do you feel like that also is, I guess, indicative of what's happening around the child before they come to a speech pathologist, meaning the peers in the class, maybe somebody's being teased
mhm,
or I don't know, or they're realizing how come Becky talks like that, but I don't, or
mhm.
those sort of things. Would you?
Oh yeah, especially the older a child gets, they become much
Mm,
more self-aware, um,
oh,
and
okay.
they could fall victim of being teased at school or outside of school, and as a result, they may become withdrawn,
Hmm.
yeah, and not engage with classroom teachers or their peers.
Okay. So you're saying that what you've seen over your years of doing this is that as a child is being um, serviced, as things are going in the correct direction for them, you're seeing growth, you're
Hmm.
seeing the changes that you're looking for as a provider. Um, the child is seeing it, and you're seeing them, so to speak, coming out of their shell a little bit more, and you're seeing tangible evidence of that self-esteem being heightened.
Oh, certainly.
Yeah,
Like I said, it's just a matter of creating that safe space and environment for
yeah.
children to thrive, and finding what their likes are, what they enjoy,
Mhm.
and being creative and developing therapy materials
Mhm.
that you think that they may you know maintain their focus
Yeah.
with.
So that could be you incorporating, oh, they love the Incredible Hulk. They love
Mhm.
Spider-Man. They
Absolutely.
love uh big trucks and
Mhm.
airplanes. And so those different types of things. So is that part of like your process, like kind of interviewing the parents as well and trying to get those cues and understand the interests of the child and whatnot, so you know the best way to go about treating?
Yes, involving the parents is critical, because you as a parent know your child the best,
Hmm.
and it's nice to know what personal goals that a parent may have
Sure.
for their child. There might be a mother that just wants their child to say "mama" or "I love
Mm.
you" when you know,
Hmm.
or
Wow.
their siblings' names, or
Yeah.
yeah,
Something that a lot of people can take for granted.
yes,
Wow.
yeah.
Okay. Okay. So can you talk about like maybe a very specific story or breakthrough of like that moment that illustrates the impact of speech therapy and what that impact can have on a child's confidence and development slash independence?
Mm-hmm. Well, I've worked with a lot of really great kids over the years. Just one example that I could think of is a child that now is in middle school. He's 8th grade, but I've worked with him for probably about 5 years now. He has a very significant speech fluency disorder.
Mm.
He's repeating sounds and words or repeating whole words when trying to express himself. Um, Very similar to what we just talked about. He was very or is very self-aware that he is disfluent. And initially, when I began working with him, he was very withdrawn and didn't engage in classroom conversations
Mm.
because he was afraid that he was going to be disfluent and possibly get teased by his peers.
Mm.
I began working with him and learned that um, he was interested in movies and he loved hip hop. So one thing that we did was we looked up different famous people who had uh, struggled with their speech in the past. So he was very fascinated to learn that people like Kendrick Lamar stuttered when he was a child. Darth Vader, James Earl Jones,
Hmm.
you
Right.
know,
One of the most famous voices of all time.
yes,
Yeah.
uh, was disfluent. Um, so learning about,
Mm.
those famous people really and people that he could relate to because he was interested in music and movies made him feel like he wasn't alone. He realized that um, even though he was disfluent from time to time, he certainly is able and capable of doing great things and making a great impression upon
Hmm.
people.
That's amazing.
Right?
What sort of impact did you see that have on his parents?
They were just really pleased with the fact that he was interested in therapy and really utilizing some of the tools that I was teaching him. Um,
Yeah.
they really appreciated the fact that you know he communicated with them more verbally. A lot of
Mm.
times, when he thought he was going to become disfluent, he would just use his phone and text them what he wanted
Wow.
or respond to questions.
Wow.
But now he's using, more words, using sentences to express himself.
Yeah.
And recently volunteered to complete a group project in class.
Oh,
Yeah.
wow.
So definitely
Wow.
building, his self-esteem, improving his social skills,
Hmm.
as well as his confidence.
That's amazing. That's amazing. What would you say are some of the common misconceptions that parents or educators have about speech therapy, and as it pertains to children very specifically?
Mm-hmm. I feel that a lot of a common misconception is that speech is a quick fix. Speech therapy, in particular, is a quick fix. Uh,
Oh,
yes,
you mean
where
like, oh, he'll just need a couple of sessions and
yes, or why does he still sound the same after a couple of sessions? Why is she
wow.
still having problems understanding or following directions after a couple of
Hmm.
sessions?
Hmm.
You know,
Wow.
it's a process.
Yeah, like
It's
anything.
it's a process. I think another misconception is that uh, speech therapy only focuses on pronunciations, whereas the field of speech therapy is vast.
Mm.
Speech pathologists, remediate speech disorders, fluency disorders, uh, feeding and swallowing disorders. Yeah,
Mm.
um, you know, language deficits and disorders. So there's a variety of things that speech pathologists are able to do. So it's not just because you're or oftentimes in meetings, I get the comment, well, I don't know why Johnny got tested. He sounds fine. And he may not have been tested because he has a deficit in articulation or delay in his
Mm,
articulation. It could be his understanding and use of language.
wow.
Yeah.
Wow. So it, there are times where parents are bought in saying, hey, we might have some concern. We think he should be tested for XYZ. And they're
Mhm.
thinking, why speech pathology? Why speech
Mhm.
therapy? He needs to go to an ear, nose, and throat doctor or or something like that.
Right. Um, right. So, one big piece of what speech pathologists should do or are doing is, really educating,
Yeah,
um, parents and teachers, just so that, they understand why uh, we're working with the children, and the best way that, we could work together as parents as well as teachers.
got you.
Um,
Got you.
I think another misconception is that I think a lot of educators sometimes think that we pull children out of class just to play games. Um,
Oh,
and again, we develop therapy sessions, based on um, a child's interest,
yeah.
right? And games aren't always appropriate, but there's a lot of things that you can learn by playing
Yeah.
games,
Yeah,
right?
absolutely.
And you can incorporate different strategies and techniques while you're playing games. So,
Mm-hmm. Mm-hmm.
it's
Learning or learning while you're playing without
absolutely,
realizing that you're learning.
absolutely. And,
Mhm,
therapists are collecting data while we're engaging in that play.
mhm.
But we certainly do more than just play uh, with uh, with our students.
Yeah. Well, I certainly hope that you wouldn't go to school for umpteen years just to come play with a couple of, elementary school
You know,
students or what have you.
right, right.
So, what's the age range for a speech pathologist for children? Is there a too young or too old?
Oh no. Another misconception is that we only work with children or young children.
Hmm.
Speech pathologists work with people from birth and you know to essentially death. From
Wow.
yeah.
Hmm.
So
All
uh,
based on the individual needs.
absolutely,
Hmm. Hmm.
absolutely.
So then tell me if I'm saying this correct.
Hmm.
There's no specification for a pediatric speech pathologist, the way that there might be a pediatric orthopedist or that sort of
Hmm.
thing. Is that a correct
Um,
assumption?
well, there are therapists that specialize in early intervention. So
Oh, okay.
that would be a therapist that works with the babies and toddlers, so
Okay.
ages 0 to 3.
Gotcha.
Um, and you know, uh, speech pathologist that works in the school system, like myself. I primarily work with children from ages 3, pre-K, to 18. You can be older, obviously,
Sure.
in high school. So
Hmm.
pre-K to 12th grade.
Got you. Like
Yeah.
an entire school career, basically.
Hmm.
Okay.
Yeah.
That's awesome. So I want to shift just a little bit and talk about cultural background and environment. How do you feel like those things, cultural background, environment, socioeconomic factors play into the child's access
Mm.
to speech therapy and, success in speech therapy?
Hmm. Well, um, families of lower socioeconomic, uh, with a lower socioeconomic background could face, some challenges if they're seeking speech services outside of um, a school setting. There may be
Yeah.
some limitations with insurance coverage.
Mm.
Um, in addition to that, there may be, some financial obstacles that they may face. Um, in certain areas, having access to a speech pathologist could be a challenge as well.
Mm. So
Uh,
do all, and I don't know, I want to make sure this makes sense.
mhm,
Do all schools have access to speech services,
mm,
or like is it a requirement? Is it, because what I'm wondering is, if I was to have a child, and my first stop is, let me go to my school, are they
mhm.
required to have access to those kind of services, or is it based on the school system, like how does that part work?
Well, public schools should have access to a speech pathologist. You know, if a child is eligible for direct speech therapy in a school
Mm,
setting, they will be given what is called an individual education program.
mm,
And the school is obligated to provide the services that are outlined in that program.
mm,
Um, you know, are there speech pathologists? Are there enough speech pathologists to cover all the schools? Unfortunately, no.
mm.
Yeah.
That goes back to what you were saying earlier about the need.
Hmm.
And if there was a need 20 years ago when you got into the field and there's
Hmm.
still a need, that says a lot.
Right.
Mm, mm.
Yeah.
Is I guess this kind of also goes back a little bit, I guess plays together the misconceptions as well. Is there any data that says every kid who needs, or every person, not just children,
Hmm.
but every person who needs speech therapy or needs the services of a speech pathologist, obviously there was a defect at birth. Obviously there's a health condition during pregnancy. Is there any data that says that's always the case? Or could it be that there's a mom who had a perfect pregnancy, no issues, perfect delivery, blah, blah, blah,
Hmm.
and their child still has that sort of issue or problem
Oh,
or needs that service?
yeah, absolutely. You know, there are a variety of things that can cause delay in your speech and language development, or, cause the need for a speech pathologist to support a child.
Mhm.
And it's not always due to a hearing loss or a neurological deficit or cognitive deficit. There, can be environmental factors
Mhm.
that can cause speech and language delays, which
Mhm.
would require, intervention
Got you.
as well. So,
Yeah. Would you say that you see more cases like that than the former? Like more cases where it's just environment, more, is that, or is
mhm.
it kind of like a 50-50 situation?
um, what I can say is that I've seen I've seen it all. um, I think in certain environments
Yeah.
or in certain school settings, I think a lot of the deficits that I see or delays that I see are a result of environment, the lack
Mhm.
of access,
Mhm.
the lack of exposure to speech and language. Um, I definitely have seen that. It just depends on where I am and what school I'm providing the service in.
Gotcha. Gotcha.
Hmm.
Gotcha. I want us to take a quick break here, pay some bills with some commercials here. But I want to continue this conversation. I feel like you're giving out some good information. I feel like the rest of this conversation, you're going to give out even more um, necessary information to the folks out there who find themselves in a place where they're like, I don't know what to do. I think my child might need, I think, you know,
Hmm.
this is a thing. So I want you to stick around. And we'll be back in just about a minute, folks. All right. Life Uncensored, navigating adulthood one episode at a time. We're available on Spotify, YouTube, Facebook, Instagram, and LinkedIn. You can also check us out on our website, life-uncensored.com. Come on over and see what you've been missing. I'm Amanda Lockhart Davis, founder of Jax Consulting Services, bringing over 25 years of industry experience to our multifaceted consulting firm. With a passion for strategic problem solving and unmatched customer service, we have crafted the firm to offer a wide range of consulting services. From financial management and strategic planning to educational workshops and specialized notarization services. Jax Consulting Services is dedicated to supporting the diverse needs of our clients. Leveraging extensive experience across various sectors, we stand ready to guide your business toward success. That's Jax Consulting Services. Visit us on the web at www.jax-consulting.com. All right. We are back with Miss Jennifer Brooks. Jennifer, thanks for sticking with us. I want to continue this very important conversation. I'm learning some stuff, and I feel like this is such a important and appropriate conversation to be having. I recently saw an article about speech language pathologist.
Mm-hmm.
Shortage in schools. And so, more specifically, that it's impacting the DC area families.
Mm-hmm.
Being that that's your home, that's your home base. What's your take? What are your thoughts on that?
Well, first of all, it's unfortunate because, it's impacting the child the most. If children can't receive the services, then they can't grow and improve academically or socially. I think it's a systematic issue. Therapists that work in school settings are overloaded. Their caseloads typically are very high, which can impact the effectiveness of their therapy, as well as cause burnout. So I think that's probably why, or I know that's why, I've had colleagues leave the school setting and work in a different setting. So, I think it's important to understand that, getting into the field is very competitive. Most graduate programs take about 20 students for their programs.
At a time.
At a time. So, 20 clinicians, and it's not guaranteed that all of those clinicians will be, filtering into the school setting.
Right.
So, I think a lot of speech pathologists might leave the school setting just based on salaries not being competitive, inflated caseloads, and really not having support.
Wow. So with that, what's kept you in the school systems?
Well, it helps that I work for myself. So, I am allowed to create boundaries that I don't think I would be afforded if I worked directly for a school system.
Oh, okay.
Yeah.
Okay. And I guess, do you feel like, or do you know, I guess is the question, whether or not there are more folks like you in the school system who work independently and you're working with the school versus those speech pathologists who are employed by the school? Do you know what that ratio looks like?
Yeah, I don't. I would assume that more therapists work directly for school systems. If I were
Gotcha.
to guess, yeah.
Got you. Got you. So then when you first started out,
Mm-hmm.
what was your first move once you got your degrees and got your credentials and were ready to go? Was your first move directly into entrepreneurship in this way, or did you work for before you ventured out?
Right. So, no, I worked actually for a staffing company for a number of years, a few
Hmm.
different staffing companies. Um, uh, and honestly, many of the administrators or decision makers for the school, they were very pleased with the service that I provided, and oftentimes told me that, we are maintaining the relationship with the company you work for because of you. We don't really
Wow.
even know or have a relationship with,
With the
your manager
firm.
or supervisor or that
Oh
company.
wow.
Right.
Wow.
So really I was encouraged by, principals, assistant principals, special education coordinators to, consider stepping out on my own, um, because of, again, the need,
Yeah.
particularly in the DC area.
Hmm.
Yeah.
So
Uh,
how long ago was that you first did that?
well, I became an independent contractor in 2012.
Oh wow. Okay.
Yeah. Uh-huh. And my business really started to take off after COVID when schools started to open up again.
Hmm.
Yeah.
Do you know why that is? Like why at that particular time frame?
Um, I think it goes back to therapists leaving the field
Mm-hmm.
or changing their setting in which they provide service.
Mm-hmm.
It also had to do a lot with the fact that there were children, during the time, during lockdown or when the world was shut down, they did not receive their services.
Mm.
But again, having that individualized education program, this was something that should have been afforded to them.
Yeah, absolutely.
So,
Mm.
oftentimes, my
Mm.
team and I are tapped to do what they call compensatory therapy. So, we still have to make up that time, even if, the student or the student wasn't available or the therapist, they did not have a therapist to provide
To the
um,
student.
the
Mhm.
services to the student. Yeah.
And you saying that as far as COVID, that whole situation does make sense because I mean, at least in my novice mind, um, because a whole lot of people didn't want to go back into the workplace
Hmm.
after COVID. And
Yeah.
then when you add to it that we're talking an environment with a lot of kids where we know that's where a lot of the germs are. You caught a cold because, you had three students at school with a cold or
Yes.
whatever. I
Yes.
can I can totally understand why folks said, no, thanks, I don't want to go back to the school setting when you use that particular situation as
Hmm.
a reason. Yeah, it
Yeah.
makes sense.
I'm sorry, I didn't mean to talk over you, but and I think for therapists, it gave them an opportunity to pivot. You know, um,
Certainly.
there are therapists that are tired of providing services, so they use their skills to either transition out of the field altogether or to do something different, just something different within the field.
Gotcha. Gotcha.
Mhm.
So how would you say that you involve parents and caregivers in the process to ensure that
Mhm.
the progress continues even when you're not with the student? Maybe it's spring break, maybe it's summer break and you're not seeing the kids throughout that time frame or
Mhm.
for whatever reason. Like how do you work with and involve the parents and the caregivers to keep
Yeah.
that continued, growth and progress
Mhm.
going?
Well, I think it's important to always stay in close communication with your parents, just so
True.
they understand why you're doing what you're doing uh, with the student or their child. Um, you know, I oftentimes provide what we call carryover or activities or speech homework for them to use, so parents can use and reinforce, those skills, um, just really while they're completing their day-to-day tasks or
Mm-hmm.
even during like structured play.
Mm-hmm.
Yeah.
Okay. So then, in addition to that,
Hmm.
how do the parents' village, so to
Hmm.
speak, their support team, brothers, sisters,
Hmm.
grandma, grandpa, and so on and so maybe daycare providers,
Hmm.
maybe children go to daycare after school, how do they support the parent and the child? Like, how does grandma watches little Johnny
Hmm.
every other weekend, or whatever. Like, how do the parents support? How do the siblings get involved in supporting the friends, the aunt?
Hmm.
How do you help cultivate that?
Hmm. Well, it depends on, I guess, the setting in which I'm providing the service. If it's a home-based service, uh, then we do get the family involved um, during the therapy setting or during the therapy session, so
Mm-hmm.
that they can see and model, what I'm doing with the child. Um, oftentimes, especially with the younger kids, their older siblings love to jump in on the therapy sessions, um, because, I guess they just can't handle that child getting that individual attention. Um, so, and children learn from from their peers and from other
Yeah.
children. So,
Yeah.
peer modeling, sibling modeling is great. So, just trying to get them, getting the family and their support system or village that you mentioned, as involved as possible.
Mm.
So encouraging parents to share, the carryover activities and worksheets that I provide with people that were going to be with the child, you know, on the day to day, you know,
Gotcha.
and yeah.
Gotcha. Have you ever had situations where you are providing services for siblings, multiple children that have maybe even different needs, but
Hmm.
still the need of a speech pathologist? Have you ever had to simultaneously do that?
Yes. I have. It could be an older sibling and a younger sibling. It could be twins or triplets.
Mm.
Um,
You've
yeah,
serviced triplets before?
yeah, I have.
Wow.
Um, and sometimes you can group them together,
Mm-hmm.
and sometimes you can't.
Okay.
But yeah, I definitely have worked with a family that have had children, more than one child
Yeah.
within the family that requires my support.
When that happens, are you finding that there's more that have the same need, or more that have families, more that
Mhm.
have different needs? Or would you
Uh,
say it's about the same?
are you asking? Do the children have similar needs?
Yeah, so if you've got,
Hmm. Hmm.
a sibling situation where you're providing services to siblings, are you finding more often that the two siblings have the same exact need, like they're both, or that they're completely different needs?
Yeah, I think it depends.
Mm, mm,
It depends. I definitely have seen cases or been involved in situations where we're working on similar goals. Both
okay.
siblings are working on similar goals,
Okay.
for sure.
Okay.
Because a lot of times, siblings like to do what the other sibling is doing, right?
Mhm. Mhm.
So, uh, they might be mimicking uh, the same error that their older sibling
Oh,
might be
I
be
see.
producing. Yeah.
Okay, got you. Is that kind of a, what would the word be? Like a phantom issue then in a
Linger.
case like that when you realize that
Well,
you
I
don't
think
really have this issue, you're just doing it because
right.
he's doing it.
It just depends.
Yeah,
It just
yeah.
depends. Yeah.
I imagine that that could probably come up in some cases.
Hmm. Hmm.
Wow. Okay. Okay. I want to talk about how we can help those who are listening right now.
Okay.
What's one piece of advice, if all you could do was just give this one piece of advice and just let the chips fall where they may, what would that be for parents, the
Hmm.
educators, the village, um, who are concerned about their child's communication development? Like, what would that be? What would that one piece of advice be?
Um, if you have a concern, even though children develop at their own uh, pace or rate, um, you know, it's okay to look into it. Don't think that this is something that your child is going to grow out of.
Mm. Do you see
That's
that a lot where people are like,
that's
"Oh,
a
he'll grow out of it"?
yeah. We were talking earlier about cultural differences. There are certain cultures where speech therapy may not be a priority, right? Or they may believe that, um, their child may grow out of the, however the child is presenting. So they may not, people of different cultures may not seek the support that could, that could help the child. Or if they do seek the support, they may not be, completely vested, which could impact, overall progress.
That's kind of sad.
It is, it can be, but I think it all goes back to, you know, really educating, parents.
Yeah. Yeah.
Yeah.
Is there a lot of outside of like what's happening today? We're having this conversation to get the
Hmm.
word out, and I'm sure there's things like in schools and maybe even at doctors' offices or whatnot. But
Hmm.
what sort of, how do parents get the information? Like, how do people get the information?
Hmm. Um, you can get information, like you had mentioned, from your pediatrician. Social media has really been
Mm,
an excellent resource. There are therapists that have pages dedicated to, sharing um, and talking about developmental milestones,
yeah.
strategies that, may work with your child or for your child.
Yeah.
Um, you know, um,
Mm,
there's community organizations that also um,
mm,
can provide, information as far as, if you suspect your child has a speech and language delay, these are the steps that you need to take in order for the child to participate in a speech and language screening or get evaluated.
that's awesome.
Um,
I imagine that some people may think that um, a speech pathologist is needed only if, oh, he has a stutter,
mhm,
or only if uh, he's not pronouncing ths,
mhm.
those sort of things. But it goes much deeper than that, doesn't it?
Yes.
Because
Um,
you mentioned earlier about the whole like it might be the swallowing.
mhm.
Like, can you talk a little bit about what that looks like for somebody who's just like, oh, I didn't realize that was a thing?
Well, there, as far as working with, I guess maybe infants and toddlers, um, they may have. issues with, managing food, tolerating certain textures of food. Um, so it certainly can be an issue that's mechanical, or
Mm,
it could be a sensory issue.
mm,
So a speech pathologist would participate in, supporting a child so that they are feeding or swallowing, eating their food safely, so they
gotcha.
don't run the risk of aspirating or
Yeah.
choking.
Wow.
Yeah.
So, to that point, what's the difference between a child who needs a speech pathologist in that situation
Hmm.
versus a child who has the term, I want to say reflux, but that's not the term.
GERD.
Where the gag
Hmm.
reflex is that, would
Hmm.
that be encompassed in that, like what you're
Yeah.
describing?
ab-
Oh,
Absolutely.
okay.
Absolutely. Hmm.
Okay. Oh, wow.
Yeah.
So I would see a speech pathologist for if I noticed that sort of issue.
Hmm. Yeah. You certainly could be referred to one. Hmm.
Wow.
Yeah.
Okay. And see, again, I'm learning stuff I didn't know before. So that's awesome. That is awesome.
Hmm.
I think one of the things that people fail to realize with this profession very specifically is, like you said much earlier, just the wide range that it touches.
Hmm.
Um, the fact that you can even see children, like you said, even at infant stage,
Hmm. Hmm.
that's fascinating because you
Yeah.
hear speech pathology, you think, oh, he's a stutterer.
Hmm.
Okay, but it's so much deeper than
Yeah.
that. Wow.
Yeah.
So I guess I want to ask you, kind of as like a final thought in this whole
Mhm.
situation, is what does unlimited expressions, what's the mission? What do you want to convey? What do you want people to walk away with in terms of getting care for themselves, their children,
Mhm.
their loved ones? Like, what does unlimited expressions want people to walk away with?
Well, our motto is, we want children to reach their limitless potential.
I love
Um,
that.
Thank you. Um, we have that motto because we provide, speech therapy, to empower children to express themselves, not just within the school setting or as they matriculate through school. But, having strong communication skills is something that you'll need forever. Um, in addition to speech therapy, we're starting to provide occupational therapy, um, personalized one-on-one
Wow.
tutoring, as well as family and parent advocacy.
Yeah.
Yeah,
Wow. That's awesome.
thank you.
And I just feel like, and you tell me if I'm out of line by saying this, but I just feel like speech pathology can make the world go round, so to speak, with how people in general deal with the world.
Hmm.
I.e., maybe I'm not confident to join that football team, though I love football, though I'm
Hmm.
so athletic. But I don't want to be on that team or I don't want to join the team because I don't want to be teased or, whatever the thing
Hmm.
is. Would you agree with that thought that I'm having as far as that goes?
Yeah.
Mm,
Um, Speech pathologists, we provide tools, and strategies so that a child at least in the school setting,
yeah.
can thrive academically.
Hmm.
But, a big part of school is that social component.
Yeah, exactly.
Yeah.
Yeah,
So we definitely tap into, working on and improving those social language skills as well.
absolutely.
Hmm.
That's amazing. I love the work you're doing. I wish there was more of you out there. I
Thank
wish it
you. I
was
do
more
too.
out there.
Trust me, I do too.
I mean, because like you said, to your example earlier, there's a lot of famous people that you would have never thought
Mm-hmm.
had some sort of speech impediment or something of that nature.
Mm-hmm.
Heck, President of the United States, Joe Biden, had a speech
Mm-hmm.
impediment,
Absolutely.
and he held the highest office in the land.
Mm-hmm.
So that, sharing that sort of thing with your clients has got to be some form of like assurance, like,
Mm-hmm.
oh, well, James Earl Jones, Kendrick Lamar, who
Right.
really?
Yeah.
He's my favorite rapper, or
Right.
whatever. That's
Right.
just, and there's so many. Those are just a couple that
Oh yeah.
but there's so many
Mm-hmm.
that's their story. Steve Harvey, he talks about it all the time. He's very open about talking about that sort of
Absolutely.
thing, you know. And that man is on every TV station in the world and radio.
And
So
radio. Yeah.
like you can go far, like your, and I hate to call it a disability because I don't think it's that. Your challenge, because everybody has a challenge in life. I don't care what
Mm-hmm.
your thing is. Your particular challenge does not hinder you from being great. And I think that's the
No.
message that people like yourself put out into the world every day. So that's
Thank
awesome.
you.
That is so
Thank
awesome. I
you.
just I just love that. Jennifer, I'm going to wrap up here. I want you to tell the audience how to stay in contact with you, follow up on any events that you're having, any engagements, anything like that. If you can just talk a little bit about that, where they can follow you, see you, all of that kind of thing.
Sure. We are in the process of rebranding. So I know that you have my website scrolling at the
Mm-hmm.
bottom.
Mm-hmm.
Um, Unlimited Expressions LLC.
Mm-hmm.
Uh, so you certainly can go to the website. It will be changing very soon with new information and new services that we provide. There'll be some excellent resources on the website as well. Uh, you can always find out what Unlimited Expressions is doing on Instagram at unlimited.expressions. Um, we'll talk more about the company, again, the services that we provide. We will share some strategies and tips for parents to use at home. Um, we also have a Facebook group, and I am also on LinkedIn. Um,
Awesome.
if you'd like to reach out to me directly, you can reach out to me at info@unlimitedexpressionsPLLC.com.
I love it. Say it one more time for us.
Okay. Info@unlimitedexpressionsPLLC.com.
That's awesome. Thank you so much. Jennifer, I ask you one more thing that
Mhm.
I ask all of my guests to do at the end of the show, and that's to tell us your greatest joy or your favorite quote and why it's your favorite quote.
Oh, can I do both?
You can. You certainly can. I love that. I love when guests are like, oh, I can do both.
My greatest joy are my three nieces. I'm a professional aunt. My nieces range between the ages of 10 and 20, and I'm just amazed at how fearless those girls are, how inquisitive they are, and how curious they are about life. So, I always tell my siblings that I can't wait to see how the story ends with them.
I love
And
that,
then
professional aunt. I should get a t-shirt made because I
I'm
feel like I am too.
professional. um, a quote that I oftentimes, or an affirmation that I oftentimes share with my students is that you are capable and worthy of success. Um,
Hmm.
so, I say that to them to pour positivity uh, into them and to affirm them and make them realize that all the effort that they are putting into their therapy sessions are going to pay off.
I love that. You are capable and worthy with a capital W
Of
of
success.
success.
Hmm.
That's awesome. That's awesome. Jennifer, you have been an amazing guest, just as I knew you would be. I appreciate you very much. I would love to have you back again. Like I said to you earlier, you are now part of the Life Uncensored family. So I am so glad to welcome you as such. And I want to ask you to hold on for me as I close out the show for just a few minutes. Can you do that for me?
Sure.
Awesome. Jennifer Brooks, ladies and gentlemen, thank you so much. What a great, great show. Jennifer and the work that she's doing is awesome. And I'm thankful for her. I'm thankful for the insight, for the knowledge. I'm thankful that she's one of those who stuck around in the school systems um, to make sure that kids are getting the need met. Because as she shared with us, a lot of that went down, especially at after the world opened back up after COVID. So I'm just so glad and I'm proud to know her. Uh, just a few things for you guys. Don't forget, like, follow, share, subscribe. We are on Facebook, LinkedIn, YouTube, Instagram, and Spotify. Make sure you tell your friends, tell your family. We have great conversations, and I'd love to have them join the Life Uncensored family as well. If you would like to be a guest on our show, or if you'd like to promote or advertise your product or service, go to our website. Um, and what you'll want to do there is fill out the small short form and we'll get into it with you. We'll have a conversation and we love to spotlight your services, your products. We'd love to have you as a guest on the show. Our website is life-uncensored.com. Scrolling at the bottom of your screen right now, life-uncensored.com. Likewise, if you have an idea for a topic that you'd like to hear us talk about on the show, same thing, go to life-uncensored.com and share your thoughts with us. I again want to thank our 11,000 plus followers on Facebook, and I ask you and implore you and encourage you to go to our Instagram page and follow and subscribe there as well. I would like to end this show with my quote for the day, and that quote is from Miss Rita Pearson. Every child deserves a champion, an adult who will never give up on them. And I think that's what's happening with Unlimited Expressions. Until next time, stay hydrated, stay well, and do something kind for someone. You never know. You might change the world. Until next time, bye, friends.